This time is on Saturday. We have the conference. I'm Shu Zhenlu, on behalf of the Mental Health Association President and also the Vice President in Asia Pacific region for Mental Health Association, Mental Health World Federation of Mental Health for Mental Health. Such as Julie. Okay, and this time we have a lecture, conference, webinar to welcome everybody and to join. I'm delighted to welcome all of you to join Asia Pacific Region World Mental Health Day 2021 webinar conference. Mental health, although in an equal world. So this time we welcome from United States, South Africa, Australia, United States, India, Indonesia, and Malaysia, and Hong Kong, Deborah, Hong Kong. Welcome everybody from all over the country, from the world.
Regional Vice President of the Asia Pacific region of the World Federation for Mental Health. Ladies, gentlemen, honored guests and friends, I bring you greetings from the World Federation for Mental Health. And I want to thank you for the honor and privilege to present at your World Mental Health Day this morning. So World Mental Health Day 2020 will be commemorated on the 10th of October. And for the first time, the world has chosen its theme. And the world's theme for World Mental Health Day is mental health in an unequal world. Together, we can make a difference. I want to stop because this theme, it's quite loaded in terms of its core. It says very clearly, together we can make a difference. We can bring about greater equality and greater justice for those with lived experience. And so it is no wonder that I've been asked to address you this morning and focus specifically on mental health, equality, and justice for all. Because this, in a way, is the opposite, isn't it, to this theme? We want equality. We want to ensure that everyone has access, that no one is left behind. But in order to understand what this inequality presents and what it means in reality for every global citizen, it would be incumbent of me to provide you with a background and the landscape of what inequalities present and what it looks like for people with lived experience. So Kawachi and others in 2002 stated, and they said, health inequalities are those inequalities in health that are unfair and unjust. Let me repeat. Health inequalities are those inequalities in health that are unfair and unjust. So we know historically, inequalities in mental health have deprived many people with lived experience of mental disorders from living fully integrated, respected, and dignified lives. They've always been on the fringes, they've always been marginalized, they've always been labeled. And if we address these inequalities, we start to shift the agenda to respect and give back dignity. And so mental health, as we know, remains the Cinderella of health services across the world. despite the enormous burden of disease globally. And the burden of disease will and have increased exponentially due to the impacts of the COVID-19 pandemic's negative impact on mental health. We know that the COVID-19 health pandemic has a negative symbiotic relationship with mental health. You can't talk about COVID-19 without talking about its impact on mental health. These two dance in a very sinister way with each other. And so mental health has historically always been the least and less favored and under-prioritized, despite the economic impact, despite the disadvantage it has often caused. It remains a low priority, and therefore we see these massive treatment gaps and disparities in mental health care. According to the World Health Organization's Mental Health Atlas in 2020, the survey that was done, they found that governments spend on average 2% of their health budget on mental health. Now, I ask, how do we begin to address these massive gaps which have increased exponentially with a 2% allocation on average of health budgets for mental health care and services? But the situation is, it gets bleak when you start breaking it down, because in low-income countries, only 1% of the health budget is spent on mental health. And in high-income countries where there is wealth, only 5% on average is spent on mental health. Ladies and gentlemen, here's something fundamentally wrong. Here's something that raises huge concerns, and this lack of investment, this lack in prioritization is not going to address this divide that we are speaking about this morning. So naturally, this underinvestment in mental health has a significant impact on access to mental health, particularly in poor and under-resourced communities and rural areas. The World Health Organization in 2012 found that between 75 to 85% of people with severe mental disorders in low-income countries have no treatment. In my country, South Africa, in some communities, it is up to 95%. Devastating. But we can't be proud, because high-income countries, I believe, where they have the funds, they have the money, they're wealthy countries, found that the percentage drops, yes, from the 75 to 95% we've just spoken about, to between 35 and 50%. This cannot be acceptable, surely. And so with this lack of investment and layered over all of this, remember the study and survey was done in 2012, comes COVID-19 pandemic and prevalence increase. So what shifts have we seen, if any, in this investment in mental health? And so we know that the lack of access to mental health care infringes significantly on the human rights of all persons with lived experience. So the inequalities that we speak about has a direct impact on human rights. The right to care, the right to health care, the right to be included, the right to be respected. But the situation becomes more dire the more you open Pandora's box, because the inequalities due to other factors such as race and ethnicity, sexual orientation and gender, and basic lack of respect for human rights and persons living with mental health conditions continue to fuel this divide. So it's multidimensional, isn't it? But here's the monster. For centuries, the marginalization and the discrimination and stigmatization of people with mental illness has created insurmountable barriers. They've been labeled, they've been pushed aside on the fringes, and this has created enormous suffering and can no longer be tolerated. And then comes the pandemic. And we know this pandemic has had this unprecedented, rampant impact on our societies. Every community across the world has been affected. Every individual's mental health has been challenged in various degrees, but we have all been exposed. And so across the world, we have seen this impact, leaving health, social and mental health devastation in its tracks. COVID-19 lockdown measures, as we know, we've gone through various waves across the world. And with every wave and peak, there's been severe lockdown measures applied. But it came with a very heavy social and economic costs to many countries, leaving this impact significantly so and seen in under-resourced and poverty-stricken communities. In fact, it exposed the pre-existing poverty and its implications for mental health, but we also saw the escalation of poverty in these communities. And so what we have seen with COVID-19 is its evidence, its footprints, you know, across the world and its negative impacts. And these were superimposed on countries and communities that already had pre-existing structural and systemic inequalities in mental health provision, which were evident over many years. So Nuki et al. In 2010 states, and they say that very clearly that mental disorders are determined, as we know, by multiple interacting social, psychological, and biological factors. But the underlying social determinants of mental disorders, social determinants such as low levels of education, unemployment, and we saw this during the COVID-19 period, and we're still seeing the fallout as economies crumbled and stumbled, high unemployment, loss of jobs, impacting significantly on the livelihoods of many families. These key determinants, these were all key determinants for living in poverty and creating even more poverty and the divide and the gaps. And these multiple levels of social disadvantage and injustices deprives and predisposes people to mental illness. We know of the studies that have been done between the impact and the negative cycle that exists between poverty and mental illness. That if you live in poverty, you're more likely to have a mental illness. And if you have a mental illness under COVID-19 conditions, you're probably more likely to live in poverty. And they added that the unmet mental health needs contribute to profound suffering. When there's no interventions and there's no access to care and there's no support for people across this world, it leads to grave suffering. And so in almost all nations, the poor are at higher risk of developing mental disorders compared to non-poor. Poverty, ladies and gentlemen, is both a determinant and a consequence of mental health, this negative cycle. And so it was Dr. Martin Luther King Jr. who said, all forms of inequality, injustice in health is the most shocking and inhumane. Let me rephrase and repreface. All forms of inequality, injustice in mental health is most shocking and inhumane. And so it is therefore no wonder that the World Federation for Mental Health in its vision and in its work calls for this redress, calls for greater equity and equality and justice in mental health to ensure that everyone has access to quality mental health care, regardless of who you are or what your socioeconomic position is. And mental health in an unequal world calls us as mental health activists and advocates and ambassadors to call for greater inclusion of persons with mental disorders in all spheres of their lives, so that they could be respected as equal citizens of this world and equal citizens in your communities and your countries. Equal, not less, equal. And I have to ask, how many of us can with confidence say that in our countries, people with lived experience are regarded as equal citizens with equal opportunities and equal advantage? A question to ponder. But World Mental Health Day gives us this amazing opportunity as a global world and community to now raise awareness about these gaps, about these inequalities, about the social injustices that prevail in the mental health space. It gives this global community the opportunity where we can all unify our voices. We can come together. The world is open. The stage has been set, ladies and gentlemen, and we can raise our voices. And we can empower everyone to be strong and to raise their voices and to take the necessary actions. This is the problem. Our calls are often loud, but our actions are limited. But these actions may not provide the solution for today or tomorrow. But every step we take gets closer to narrowing that gap. And our hope is that we can provide and create lasting change. So the World Federation for Mental Health and this theme, this call, is a call we make for greater financial and resource investment for all global citizens, so that all global citizens can access mental health care. The call for equity in mental health and socioeconomic opportunities, because these go together, for all within a human rights and social justice context cannot be ignored. Addressing mental health inequalities and the determinants of mental disorders will promote human rights and social justice for every person with a lived experience and every global citizen. So ideally, we'd like to reverse the theme. We'd like to change the agenda that people with mental health needs and challenges face every day. We want to see a world in which mental health operates in an equal world. We want to take the out of unequal, and we want to see this world where there's justice for all. And so mental health is everyone's business. We are all affected in some way or the other. We are not immune. We are all parts of this world, and we are all connected in some way. But it is also our responsibility to make every effort to reverse, to take the out of the unequal, to reverse these injustices and the suffering and advance, push forward our actions and our strategies to ensure that equality, equity, and justice prevail for all those with lived experience, respected and dignified, and dignity given back. And so again, it was Martin Luther King Jr. who said, injustice anywhere is a threat to justice everywhere. Let's pause. Injustice anywhere is a threat to justice everywhere. Ladies and gentlemen, together we can make a difference. Together we can stand on the global stage and raise the awareness about these inequalities, but also take the responsibility to ensure that we get closer to our goal, which may appear to be idealistic, But in reality, if it is not achieved, the consequences have already been dire. And so I invite all of you to participate with your passion and your commitment and your energy so that we live in a world where no one is left behind, that everyone feels supported and no one is left alone, and that everyone feels, even under COVID-19 conditions, that there is a safety net. Let's create this equal world for everyone. It is our duty, it is our ethical and moral responsibility. And so, ladies and gentlemen, I thank you in advance for the work that you will do in your communities, in your countries, and ensure that there's redress. I want to wish you well with the rest of your proceedings this morning as you call to action a world which is kind, which is just, which is caring. Thank you so much. Wishing you all of the best. Stay well. Take care. Sending you blessings. Thank you.
Thank you, Dr. Ingrid. Give us a so wonderful speech. Our Dr. Ingrid, she said, mental health in an equal world. We wish from unequal to equal. Yeah. Okay. Together we can make a difference. So let's. I think and Dr. Ingrid also. She is the Capo Mental Health Foundation, South Africa. And so this time I very like and appreciate Ingrid do so much work for us these 2 years. Also, although a pandemic. Yeah. Next speech, we will invite Dr. Roy. Dr. Roy, he will give us determinants, social determinants from the unequal world. And this time, Roy Kallivayalil. Okay, welcome. Yes. Our speakers, Professor Roy Abraham Kallivayalil. He will talk about mental health in an unequal world, the role of social determinants in Asia Pacific. And he also is the psychiatrist in India. And he's a professor and director in medical department. Yeah, please, thank you, welcome. Okay.
Thank you very much. I think I will go ahead. It's a great pleasure. Thank you, Shujan, for inviting me. And it's a great opportunity. In fact, this is the first lecture I'm giving after getting elected to the director board of the World Federation. Of course, I will be taking charge only next month. So it's a great opportunity. Anyway, it's great while they're preparing. One thing the president has said is very important, because mental health is such a low priority in most of the rest of the countries of Asia Pacific. So we have to work together to make a difference to this. And I'm sure concerted efforts together with all mental health professionals, as well as other community gatekeepers, teachers, politicians, administrators, policymakers, everyone needs to be involved. And I hope all our efforts will ultimately bear fruit. And we all believe that the COVID-19 pandemic may be followed by a pandemic of mental illness or mental ill health. So let's try to prevent that. So this is it. So mental health, I will now proceed. I think I will have to stick to my time also. So mental health in an unequal world. And then mental health issues and disorders are major public health challenges And in low and middle income countries, Asia Pacific, chronic shortage, development of effective and accessible mental health systems in South Asia is an urgent priority. This is a WHO statement. The unequal distribution of health damaging experiences is not in any sense a natural phenomena, but is the result of a toxic combination of poor social policies, unfair economic arrangements, where the already well off and the healthy become even richer, and the poor, who are already more likely to be ill, become even poorer, and bad politics. World Bank this year has published a report. Mental health is one of the most neglected areas of health globally. This was true before COVID-19, but the pandemic has further worsened the status of mental health. There are several reasons why mental health has been ignored. The first one is an associated stigma. The second is a perception of mental health disorders as a luxury good, as opposed to actual illnesses. The additional top reasons include a fragmented and outdated service model. Some of these include the provision of mental health services, mainly in psychiatric hospitals, where severe lack of preventive mental health service, lagging policy changes, and also a shortage of human resources. Suicides and mental disorders in Asia. Population-based studies on suicide in Asia revealed that about 60 to 97% had diagnosable psychiatric illness disorders. Only 35 to 40% of suicides in India and China received the diagnosis of depression. The association between depression and suicide is less pronounced in Asia. Demographic and sociocultural risk factors for suicide in Asia are different from Western countries. Suicide is a major public and mental health problem in Asia, and there is an urgent need to develop effective national suicide prevention strategy in Asian countries. Needs, gaps, and opportunities for mental health care in Asia Pacific in the context of COVID-19. The COVID-19 pandemic has highlighted the urgent need for equitable standard and e-mental health care. It has also highlighted the persistent social and structural inequities that contribute to poor mental health. The Asia Pacific region is vast and diverse. Findings from the region can guide policy and practice in the delivery of equitable mental health care in the region and beyond. The COVID-19 pandemic has further highlighted the effects of inequality on health outcomes. Lack of investment in mental health disproportionate to the overall health budget contributes to mental health treatment gap. Many people with psychiatric illness do not receive the treatment that they are entitled to receive. The 2021 World Mental Health Day theme, Mental Health in an Unequal World, will enable us to focus on the issues that perpetuate mental health inequality locally and globally. Coming back to social determinants of health, the social determinants of health are the economic and social conditions and their distribution among the population that influence individual and group differences in health status. They are health promoting factors found in one's living and working conditions, such as the distribution of income, wealth, influence, and power, rather than individual risk factors such as behavioral risk factors or genetics that influence the risk of a disease or vulnerability to disease or injury. The distribution of social determinants are shaped by public policies that reflect the influence of prevailing political ideologies of those governing a jurisdiction. These social determinants of health are clearly related to health outcomes, are closely tied to public policy, and are clearly understandable by the public. They tend to cluster together. For example, those living in poverty also experience numerous other adverse social determinants. The quality and equitable distribution of these social determinants are clearly well below the standards seen in developed nations. Closing, this is a WHO document. Reducing health inequities is an ethical imperative. Social injustice is killing people on a grand scale. WHO Commission on Social Determinants of Health published a report entitled Closing the Gap in a Generation. This report identified two broad areas of social determinants of health that needed to be addressed. The first area was daily living conditions, which included healthy physical environments, fair employment and decent work, social protection across lifespan, and access to health care. The second major area was distribution of power, money, and resources, including equity in health programs, public financing of action on the social determinants, economic inequalities, resource depletion, healthy working conditions, gender equity, political empowerment, and a balance of power and prosperity of nations. International health inequalities. Even in the wealthiest countries, there are economic inequalities in health between the rich and the poor. Globalization is a key context for the study of social determinants of health. The impacts of globalization are asymmetric. As a result, there is an uneven distribution of wealth and influence both within and across national borders, leading to negative impacts on the social determinants of health. Life course perspective. Life course approaches emphasize the accumulated effects of experience across the lifespan in understanding the maintenance of health and the onset of disease. The economic and social conditions, the social determinants of health under which individuals live their lives have a cumulative effect upon the probability of developing any number of diseases, including heart disease and stroke. Mental health inequality. Mental health inequality refers to the difference in quality of mental health and mental health care for different identities and populations. These are economic and social conditions and influence individual and group differences in mental health status and care. Inequalities may include presence of mental health, access to mental health care, quality of mental health care, and mental health outcomes between populations with different race, ethnicity, sexual orientation, sex, gender, socioeconomic statuses, education level, and geographic location. Predictors of mental health inequality. Socioeconomic status is both a strong predictor of mental health status and a key predictor of mental health inequalities across populations. It seems clear how the stressors associated with poverty and low socioeconomic status can compromise an individual's ability to maintain a positive sense of well-being and the absence of mental health problems. Communities living in the deepest poverty have the highest need for mental health resources, but have the least amount of access to them. Utilizing proper resources to maintain positive mental health is not only costly and therefore unaffordable for the specific populations, but the resources are also not properly distributed between regions and communities. Access means many things, including the physical presence of resources, the legitimacy of resources, the affordability of resources, if they exist, ability to get to such resources, transportation, and level of comfort reaching out of resources due to stigmas. Education disparities. I'm not going into details because of the lack of time. Disparities in quality of mental health care. There's a growing unmet need for mental health services and equity in the quality of these services. While these services often advertise themselves as being a support system and caregiver for any and all who need treatment or support, certain aspects of an individual's life, such as race, ethnicity, and sexual orientation, will determine the type of care that they are given. It is well known that social factors affect the risk for mental illness and substance use disorders, as well as health outcomes of persons with these disorders. Psychiatrists and other mental health professionals are cognizant of the fact that the etiology of mental illness and substance use disorders are partly driven by social risk factors. Some psychiatric conditions may have genetic underpinnings that are increasingly understood through ongoing research. Social factors also contribute to risk, although to varying degrees across diagnostic categories and across individuals. Biopsychosocial model in formulating both etiology and course outcomes testifies to the broad recognition of the importance of both biological and social factors in shaping behavioral disorders. Understanding global mental health. Discussion about the nature and vision of global mental health agenda oscillated between two antagonistic poles. One described it as a bottom-up public health movement driven by local knowledge and priorities with the aim of providing access to mental health care for everyone. On the other end of the spectrum, GMH was seen as a top-down imperial project exporting Western illness categories and treatments that will ultimately replace diverse cultural environments for interpreting mental health. Fundamental human rights crisis. There has been no global outrage about the dramatic treatment gap in mental health care. Unlike its colonial predecessors, tropical medicine and international health, global mental health is shaped by a post-colonial framework which asks what we can do collaboratively rather than what we, the West, do for you. GMI's movement was grounded in the belief that mental health care intervention should be driven by local knowledge, and that such knowledge should flow in both directions between the global South and the global North. In this vision of global GMH, a shifting of power from places like Montreal to places like New Delhi is necessary. Divide between a powerful global north and receiving global south. This division reflected a political argument. Epistemological dimensions as to whose knowledge actually counts in the GMH discourse. Western psychiatry and traditional healing practices engage in an asymmetrical relationship in which traditional local practices have, quote, less resources, social capital, and power because they are the traditions of the poorer people, unquote. To promote mental health at the population level and to reduce the risk of mental illness and substance use disorders, psychiatrists and other mental health professionals have a role in altering clinical interventions, implementing and evaluating programs, and advocating for policy change. This work will require new forms of training quite different from those of the medical model, and it will necessitate working in partnership with diverse disciplines, expanding the concept of mental illness from the individual level to the public health as a whole is central to the social determinants of mental health framework. Improving health conditions worldwide. Reducing the health gap in a generation requires that governments build systems that allow a healthy standard of living, where no one should fall below due to circumstances beyond his or her control. Social protection schemes can be instrumental in realizing developmental goals rather than being dependent on achieving those goals. They can be effective ways to reduce poverty, and local economies can benefit. Achieving better mental health equality. Improving access to health care for the underprivileged. The biggest reason why people are not obtaining mental health care is because they cannot afford it. Also, changing the content of healthcare to include mental health is equally important. Mental health is still not considered to be a main part of basic health care plans. In order for individuals to receive the treatment necessary for mental disorders, it must be acknowledged as an illness. The challenge of integrating evidence-based medicine and cultural psychiatry raises a question of methodological, epistemological, and political pluralism. The need to recognize different types of knowledge, namely outcomes, should be measured not only in terms of symptom reduction, behavioral change, or level of instrumental functioning, but in terms of individuals' ability to pursue culturally relevant goals, including the impact on the family and community. WHO said actions and public policies to address existing health inequities need to be universal and inclusive, and proportionate to need. Targeting resources of the most disadvantaged groups alone runs the risk of distracting from the overall goal of reducing the steepness of the social gradient in health. We have published quite a few on this COVID-19 pandemic. This was our publication in the Asian Journal of Psychiatry. Again, we have this publication, Frontiers in Psychology, on the Resilience in the Indian. These are all COVID-related publications. If anybody is interested, I can send you. And this is again in the Indian Journal of Social Psychiatry, Othering in Pandemic, Prejudice and Orientalism. Pandemics are not just medical phenomena, they affect the society at large, having long-lasting psychosocial implications throughout history. They have led to stigmatization, prejudice, othering, and blame. And these are some of the, I come from the southernmost state in Kerala, some of the initiatives we have taken up here in Kerala. COVID-19 and mental health inequalities. The COVID-19 pandemic has and will continue to affect people of all ages in many ways. Through infection and illness, sometimes resulting in death, bringing bereavement to surviving family members. Through the economic impact with job losses and continued job insecurity, and with the physical distancing that can lead to social isolation. In conclusion, the greatest population-based impact for improving mental illness and substance use disorders will be achieved by optimizing public policies to make them more health-promoting and by altering social norms so that the health of all members of society is a priority. This is especially so as the world is facing COVID-19 pandemic. The 2021 World Mental Health theme, Mental Health in an Unequal World, calls for intersectoral collaboration in a unified efforts for all mental health professionals and stakeholders. Finally, let's work together to make mental health a global priority. This is the symbol of the city of Chandigarh in India, where I had my PG training. This is designed by French architect Le Corbusier, who was the architect of the city. This is a symbol of the open arms. If you visit Chandigarh, you can see this, which means open to receive and open to give. That should be our motto in mental health. And these are some of the activities. This is a recent disaster there, natural calamity, and we have been just before the pandemic set in. You can see that we are with the people. Thank you very much for your patient hearing.
And thank you, Professor Roy Abraham Kallivayalil. Thank you for our speech from President Ingrid Daniel. She is now our World Federation Mental Health, the president, and give us mental health equality and justice for all. And thank you, Professor Roy. Mental health in an unequal world, the role of social determinants in Asia Pacific. And this time, I just thank you our very special speech. And Roy will be next, our Vice President in our Asia Pacific region. And congratulations. And
thank you.
And this time I am. Okay. And so we'll conclude and our special speech and for the first and inequality and to equality, and second economic and social determinant our poor maybe poor more poor, more low health condition. And so, and third, the budget is also the least likely to increase in every country, only 2% from 5%, maybe some rich country. And low economical, maybe only 1% budget from the country. And the fourth, pandemic increase maybe our mental health down here, and some people with mental illness, they could not have good take care or good treatment, so increase their deterioration. So we think treatment is very important in CRPD, the right from treatment and health. I think it's a very good important. And the fifth lawyer mentioned about the role of mental health professions, promote the knowledge. And the sixth, maybe the suicide rate in Asia area is higher than other area. I think it's maybe it's a very special. Right? So, and another is reduce generation gap and culture event, and so I think it's a very important. Okay, then anyone want to give our comment and or any question to Roy or Ingrid? Okay, we can open. Roy, would you want to say something more?
I would only say that our responsibilities will become further worsened because of the pandemic is going to make the gap even wider. So we have to, because the unequal world is going to become further unequal. So it's our duty to, or the mental health professionals all work together. And of course, we may not be alone. It may not be enough that we work to our within ourselves. We need to go out to society to influence the policymakers, the administrators, the politicians, in governments, and this needs to be done in every country. And it will be nice. That's the only way we can influence, because they, as I was mentioning, they think these are all luxury goods. mental health is luxury. It's only. Otherwise, also people are going to survive. No problem. Even if you do not have an air condition, you can survive. If you do not have a car, you can still survive. So mental health is not included in any priority. So this has to change. Thank you very much.
Thank you, Professor Roy. And any question about from the audience? If you have any question, you can ask or use Slido to give us. And how about Julie? Would you share something for us? How about Australia? We know mental health policy is very good in Australia. Can you give some comment? Okay.
Yes, we do have some very good mental health act in Australia. Janet Ma, who's with us today, could tell you more, but we also do still have problems with mental health services, particularly in the community and for services that are run by people with lived experience. We still have a long way to go. However, we do have programs and warm lines run by people with lived experience. And we do have legislation which is very clear around issues like seclusion and restraint and human rights. So, but Janet might be able to add more if she would like, but yes, thank you.
Okay, thank you, Julie. And how about Nancy Wallace, professor, and you are the UM relatives, yeah? Okay, Nancy, can you hear?
Thank you so very much.
Thank you.
Yes, thank you. Yes, here in the U.S., we do have quite a lot of mental health services and resources, but like almost every country in the world, there are great disparities with access to mental health care between the rich and the poor. And it's not only access, but the types of services that are available. We do not have universal health care, so many people don't have insurance and can't afford mental health services. We have a huge population of homeless in most of our major cities, many of whom have mental illness. And it really is human rights and a social injustice situation, which needs to be addressed in this country. Like many other countries in the world. So, well, we have many more services available. We also have great inequalities. Thank you.
Okay, thank you, Nancy. And Dr. Professor Li Mengzhi, how about you can share some?
President Liu and dear speaker and all the colleagues. Thanks for the excellent speech. And I would like to raise one point. Just as the speaker mentioned, in the pandemic, talking about inequality, and we should pay more attention to the elderly because they in a very disadvantaged stage, and the mental health could be more worse in the pandemic. So in the global mental health viewpoint, we should pay much more attention to the elderly, including those who are suffer from the minimal cognitive impairment and those always suffer from the depression in the elderly. So I'm happy to join the meeting. I'm the president for World Organization Family Doctor Asia Pacific region. Thank you for invitation.
Thank you, Professor Lee. And how about Janet from Australia? Yeah, okay. See you again. Would you want to share something about your feeling, your experience, and Okay.
I think she's just trying to unmute and having a little trouble.
Okay, never mind.
Oh, here she
You
comes,
can,
Janet.
we can hear you. Okay. Do you like to say some words? Say some words? Okay, but your microphone should open. Okay. Okay. Maybe we can left some minutes for you in second or third session. Okay. Okay. We would like to
That worked?
hear you.
Has
Okay.
that
Okay.
worked? Can you hear me?
Yes, we
Oh,
can hear
good.
you.
Thank you for having this webinar. It's very, very interesting. And it's exciting that this technology is now joining us for a sharing of knowledge. And thank you very much for inviting us from all over the place, all over the world, truly international. It's lovely to see you, my friends and colleagues, and I hope to see you again middle of the year, I think, in Taiwan, the middle of next year. So I'm very proud to be helping you out with the Convention on the Rights of People with Disabilities on the International Review Committee. It's very hard work to work through all those reports and things, and I don't think we'll ever do justice to our mental health sector because there's so much to do. So little willingness on the part of governments to help us. But wherever we have good people, we can bring change. And that's really good that Taiwan has good people.
Okay, thank you.
Thank you.
And thank you. And this time, Slido, one person asked about how do we avoid the improper application of Western psychological theories to Eastern cultures. How about Roya?
Yeah, I can.
How about?
That's a very that's a very useful question because we follow many of the Western theories and Western philosophies, ignoring what is available in our own country. For example, if I come to I know about the Chinese medicine, I know about the Ayurveda in India. They have many traditions which are actually helpful to people. For example, in Ayurveda, for example, what they practice, what is a patient is what they practice is known as a guru-chela relationship, which is a teacher-disciple relationship between the physician and the patient. So that itself is very therapeutic. And rather than going to Western models of psychotherapy, if we stick on to these forms of treatment models in the Eastern countries, respective to each country, China has got their own experience. Many other Eastern countries have. I know very clearly from India how the traditional healers. What I have been practicing this. I have been collaborating with them to the extent that whenever there is a severe mental illness, they will always refer the patient to our center, because when they manage some common mental disorders, if they have a family dispute or there is an adjustment problems, they will use some traditional, then they may give them some ashes and bhasma, they call, and say that you take it, you will do well. That acts psychotherapeutically. And I don't try to negate them. I don't try to hold them down. I don't try to ridicule them. So these are all very helpful. And many of these practices can be used into our own cultures. And I think we have fundamentally very strong cultures in Eastern countries. When the treatment gap is as high as 80 to 90%, what's the other way? What's the other way around? no psychiatrists or mental health professionals cannot treat everyone. We have to empower people to work collaboratively with us. Thank you.
Thank you, lawyer. And this session will close for use. Dr. Ingrid says something about mental health in an equal world. Together we can make the difference. Change to together we can make difference and greater equality and greater justice for those live with experience. Okay, respect everyone. Dignity to everyone. Thank you. Thank you.